Our friend Patty Olinger joins us right now, expert on infectious diseases. We were talking earlier about monkeypox, and I guess, Patty, I'm reading differing opinions as to the potential of the pandemic here from monkeypox. It looks as if the World Health Organization is saying, probably not going to happen. But then I read a headline that says there's a short window of opportunity. I don't view it as an opportunity if it's going to be a pandemic. But I mean, where do we stand? Should we be concerned about this?
We should be just aware of what's going on. I think that, we're not even completely out of the COVID-19 pandemic, so everybody is a little on edge, and that's our most recent experience. This is a completely different virus, and it's a completely different way of being transmitted. And so I think what the World Health Organization is trying to say is the likelihood of a pandemic like COVID-19 is just not going to happen. But the window of opportunity to get a handle on breaking that chain of infection is right now. And part of it is let's be aware of how it's transmitted and what we need to do to break that chain.
All right, give us some sense of that. What can we do?
Know what your risk factors are. If you've been traveling to Europe and, were involved with potentially risky behavior where you might have been infected. If you're caring for a patient that has monkeypox, know that you are potentially exposed. Wash your hands. It's what we learned during COVID-19. Wash your hands. Clean those high touch points. That are in your businesses, and be aware if you start having symptoms, go to your doctor.
And we've talked about the travel. There's been some hot spots around the world. Where are those concerns? What should we be concerned about?
There were a couple raves. I believe it was in Brussels and Spain that there were, where they're looking at potentially some of what they would call the sentinel cases that then would travel home and then they potentially infect their family members. So if you can do contact tracing back to one of those hot spots, that would be one of the things that you would want to be concerned about.
And when it comes to some of the symptoms, are there a couple of things that we need to be aware of?
Sure. I hate to say this because we say it almost on every single infection. Yeah. Flu-like symptoms.
Right.
But be aware of those. And then also a rash. If you start to get a rash, that ends up being like chickenpox, little pock marks, you need to go see the doctor.
And you said if there's risky behavior, are there certain things that could separate you from others if you were involved in this kind of behavior? One of the things that they're contemplating and they're talking about is sexually transmitted, and they haven't ruled it out, although intimate relations with somebody who is infected would be considered, a risky behavior. But having said that, even if I happen to hug and kiss somebody who was infected and they didn't know it, say, that would be potentially an exposure for me. Right. And one of those was male to male, right? When they were talking about sexually transmitted, that was one of the leading causes, right?
I believe that what happened was that the initial what they would call sentinel groups were, yes, the male to male, but that doesn't mean that you could not get infected if it was male to female as well.
Patty, there was a story on last week that said now that we're seeing COVID sort of slide back a little bit, and I know there have been some hot pockets around the country, but we've seen it slide back, that other infections and other viruses have started to ramp up. Have you seen that? Is that a natural occurrence?
Well, if you think about it, during the high points of the pandemic, we were more, we'll say, sequestered. We weren't going out in public. We were washing our hands more. We were wearing our masks. And so even the flu numbers had gone way down. So now that we're starting to relax, and if you think about it, you're not seeing people wash their hands or using hand sanitizer as much. You're not, paying as close attention to the high touch points. Hopefully we're going to see more air, but we're starting to see the flu numbers potentially come back. And I think those are the things that we're going to see. And hopefully, we can think about it for a minute and say, okay, some of these behaviors that we've shown, washing our hands a lot, cleaning surfaces, air, taking care of the air, are those things that will help us protect us from other viruses as well.
Yeah, it seems simple enough, doesn't it? I noticed in a couple of public places I was at on the West Coast this week that hand sanitizer was still everywhere, and I found myself going to it, especially when I'm in a crowded place when there's a lot of folks touching, the doorknobs and things of that nature. We just need to become accustomed to that, right?
Oh, absolutely. That's one of our number one behaviors of defense. And so you're absolutely right.
All right, Patty Olinger, thank you very much for that insight.